Hey there, this is Dr. Tonya Olson with Fixing Your Feet, or Dr. Tonya Foot Care. And in this video, I'm going to go through taping the ball of the foot. So we want to start off with clean skin that has been prepped with some type of liquid resin, such as Skin-Tac or Mastisol, to help the tape be stickier and to adhese better. And then I always pre-cut my tape so you can kind of eyeball the ball of the foot. You want to anchor it at the first metatarsal or the first foot bone at the big toe, and you want it to curl around and end at about the same place at the top of the fifth metatarsal or the fifth foot bone adjacent to the little toe. So here's a little bit of a trick for tape handling. In order to dislodge the backing of the tape, pull straight down, and then that backing will become untethered to the tape, and this way you don't hardly have to touch that tape at all. And now we can be managing the tape with the thumb and forefinger in one hand, and then just a little tiny tip of it with the other hand. So here's the trick with the ball of the foot. You want to have the tape come up as high and along the seam or the juncture between where the toes join the ball of the foot as much as possible. So as you can see, we have a pretty extreme curve here, which is actually really common. So what you want to do is, you got some handling techniques I'll kind of show you. So what I'll do is I'll start off with, first of all, we'll talk about what the hamburger, this is a hamburger grip. Like you're holding a hamburger, and you're going to use this part of your hand, which is like the thenar eminence or the base of your thumb, or the palm, base of the palm here. And I'll use that to you eyeball this angle, kind of mimic that angle, follow the angle of the ball of the foot, lay the tape down along that top of the foot. And here's where that hamburger grip really comes in handy. You want to be laying down, as you're laying down the tape, you want to be providing a little bit of tension here, and then opening up the foot, like you're smoothing out the wrinkles. When you bend it back like this, kind of spread the metatarsal heads or the foot bones apart, you're smoothing out the wrinkles. And then the pressure of your hand on the foot skin is reducing the wrinkles. And then so what I'll do is I'll get to like the fourth toe, and I've got that good hamburger grip where the base of my thumb is in good contact. And then I'll add a little bit of tension to be able to get the wrinkles out and wrap that around up onto the top of the fifth toe, the fifth metatarsal. And then if we've done a nice job following that along, all this tape is laid down along the ball of the foot nicely. So what I'm going to do is I'm going to pretend that did not happen. Let's pretend you did all that, you thought you did a beautiful job, and then you ended up, oh hell, with a wrinkle. Do not panic. There's no need to panic. This tape, that's why kinesiology tape works so well for taping the toes, or the foot and toes especially. You just pinch down. Anytime you have a wrinkle in kinesiology tape where you don't want it to be, you don't necessarily have to retape it. You just have to pinch that tape down, and then take your cuticle scissors and trim it down. Now at the end of the day, if you have a little bit of a wrinkle here at the bottom of the foot, it's not a big deal. Do not panic. And then you use the base, the inside of the backing, rub that down so that the tape adheres to itself. You don't have a big gaping seam. Tragedy averted. Now, the next thing you want to be concerned about is this leading edge. We don't want this to peel up and have the tape become dislodged, now do we? So here's where we have the figure eight, or my interpretation of a figure eight. This is made out of cover roll or hypofix tape. You can see it's very, very thin, has good adhesive to it, and it's very forgiving to put between the toes and to tape down that leading edge. So this is one of the few times where I will actually just take all of the backing off, touching the tape as little as possible, and just laying this down in between the first and second toe, making sure that this comes up and you're having the tape up as close to where the toe and the foot meet. And then you just gently, without any pressure, lay the top part of the figure eight just on the top of the foot. And really not putting a lot of tension at all. No tension, because you don't want to floss between the toes and create tension, because that could be uncomfortable. So we'll take our second piece of, I don't know, you know, I've been cutting these for 16 years. I still can't seem to get, these don't have to be perfect. Just forgive yourself. I think the biggest thing you want to worry about when you're cutting this tape is just make sure that this isn't too skinny, because then you get a little bit of a flossing effect. So lay this down and you'll see I'm using my thumb. I'm using a little bit of the hamburger grip here, spreading the toe and just laying that down gently on the top of the foot. Now, don't panic. You see a little bit of a wrinkle here. It's really not a big deal. This tape is so thin. This tape is so thin, doesn't really take up any space. If you got a little wrinkle, it's really not a big deal. So there you have it. We've got the ball of the foot covered. The leading edge is tacked down, and you're good to go for the ball of the foot. Enjoy practicing.